UTGSU health and dental plans are going to participate in the QP 3907 Healthcare Plan A top-up plus the healthcare spending account. For those of you that are also part of 3902, this is the same exact plan that the TAs have in 3902. So just a heads up to everybody, 3902 is currently in bargaining. So a win for them is a win for us. So just keep that in mind as you guys are getting information about bargaining as it comes in. Okay, so basically QP 3907 is responsible for fighting for your access to your healthcare spending account and the additional top-up plan that you receive to your UTGSU plan. That being said, we are not responsible for the UTGSU plan. We don't manage your access to any of these plans. That is because the employer automatically enrolls us, but it's up to each member to activate and utilize it. So as you can see here, there is a phone number and an email address if you guys have specific questions about your health plan that we're unable to answer here. And just for complete transparency, I am an international student. So I've only had Canadian health insurance for the last 2.5 years. So everything I've learned about health insurance has sort of been through these workshops and utilizing this health plan. So just to give you guys a quick heads up, I know the first question that people normally ask is, how do I find my policy number or plan number? So the UTGSU plan, as you can see here, is UTG plus your student number. Your top-up plan or your HCSA plan is UOT plus your personnel number. How you find your personnel number, you can either contact HR, you can contact labor relations, you can contact also the accounting person in your department. They will all have your personnel number. And that is going to be the number that you would use for your top-up plan. All right, so how to register. So as I said before, you're enrolled by HR once you get your GA contract. So we don't have any sort of power over how or when you get enrolled. For those of you that are first years, you may notice, or you may have noticed, that this fall it took a little bit of time to get you onto it. That's because the employer does not create their full payroll list, employability list. That we receive until around October, November. So chances are you didn't have access to your health insurance until then, and that's because that's when they enrolled you. That's when they had you on their list. Okay, so there are two different kind of plans that you would be able to get. The first plan, Plan A, is the UTGSU health plan, plus a top-up, which we'll go over, plus a healthcare spending account. Plan B is just the healthcare spending account. So you may be getting your health insurance elsewhere. So just to let you know, there are the two different plans. Setting up your account online is pretty easy once you have your personnel number and your student number. I use the app. It's free. It's easy to download, easy to use. Call Green Shield for help. That's also a great resource. I have called them 1,001 times for help on things, and they are pretty much available all the time. They can help you set up your account, but you will need your personnel number. So please contact HR, or I believe it's also on the employee dashboard for Acorn. Okay, so when you go to Green Shield, this is what's going to come up. In order to register, again, you're going to need your plan member ID dash your number. So our plan member ID is UOT in order to access your healthcare spending account. And I believe it's UTG plus your student number in order to access your normal health insurance. The registration key is something that you'll be able to find when you click Get Registration Key. So how to claim your benefits. So it's the same way that you would be claiming in any other circumstance. You would just submit the claim to UTGSU. or you would submit the claim to that specific health plan, and then you can use the option to combine benefits with another Green Shield plan. You would submit it and then wait for the statement. In order to submit specifically for your HCSA, your healthcare spending account, because that is a different policy number, you will need to submit separately. So what is your top-up plan, right? So the QP benefits is basically adding to the UTGSU health insurance. So after the UTGSU amounts, you do get $10,000 per benefit year of prescription drugs and a maximum of $100 per custom-made footwear. Your plan also covers paramedical services, chiropractor, naturopath, acupuncturist, massage therapy, physiotherapy, mental health, like a psychologist, social worker, counselor, and a speech therapist as well. You also do, vision is also included, so you will be getting prescription eyeglasses, $175 for every consecutive 24 months, I'm sorry, and eye exams for every 24 months. The dental plan is pretty straightforward. Your plan covers basic and comprehensive basic services, so you would only have to pay 20%, major services 50%. The maximum plan pays $1,250 per covered person per benefit for all services combined. So I'll just say that again. It's $1,250 per covered person per benefit year for all services combined. So your healthcare spending account. One of the things that we work really hard for at QP 3907 is to ensure that you guys have this additional healthcare spending account. If you are on the UTGSU plan and you are there under single coverage, you get an additional $300 per benefit year. The family coverage, this is actually from, I believe it's last year's. So it's up to $600 per benefit year. So this is something tricky that I'm sure you've received emails about over the last year if you're a member of both 3907 and 3902. So because 3907 and 3902 have the same health plan, if you are a member of both, you will be using the 3902 top-up plan and HCSA. That being said, you are then entitled to a reimbursement from 3907 for that HCSA. So you must be a GA and a TA for at least one term. And if you filed as single, you would be receiving $300. If you filed as a couple, family with dependents, it would be $600. We do receive a list from the employer of who is in both 3907 and 3902. However, there have been instances in which we have found mistakes on this list. So if you have been a member of 3902 and 3907 in the last year at the same time, please contact our treasurer so that we can make sure that we get you your reimbursement. Now it's for the previous academic year, right? So if you were a TA and a GA this year, you would not be receiving your reimbursement until the following year. So it's, like I said, it's pretty straightforward, but it's just about communicating with us and making sure that we know that you should be on that list. All right, so like I said, it's pretty short, but I would love for you to be able to ask questions about anything.
Questions that we're receiving in the chat.
Great.
So the first question is, how do we access the HCSA account?
So your HCSA account is, like I said in the beginning, a different policy number. So that would be UOT plus your personnel number. And I'll put it in the chat. Green Shield is the company that we use, that U of T uses. So it's the same company. Numbers, two ways to log in, right? One is using UTG plus your student number, which would give you the UTGSU health plan. Using UOT plus your personnel number would give you access to your HCSA and top-up benefits.
Okay, I see. Yeah, I think this is what I've been missing. Thank you.
Okay.
Great. All right, so the next question is, does the HCSA just for those who were in both GA and TA, not just GA, right?
No, it's for everyone. It's for the members of 3907. All members of 3907 have access to the HCSA. The members of 3902 and 3907 would be receiving a reimbursement for one of your HCSAs, right? Because if you're in both, you're guaranteed to both. We would just be giving you a reimbursement for the HCSA coming from 3907.
Great. My claim, should I subtract from what I have claimed in my UTGSU account and then submit the rest of the claim to the HCSA top-up account?
Yes, that's exactly what you should do.
All right. And thanks for this. I'm wondering if I could be able to cover my spouse if they are not yet a permanent resident and just a tourist on a tourist visa.
You know, that's a really good question. I don't have the answer to that. If the person who asked this question wants to shoot me an email, I can try and find the answer from you and reach out to someone in labor relations.
So yeah, Lewis, if you want to do that, you are more than welcome to contact us after the presentation. Thanks for the great questions, y'all. And the last question is, for U of T personnel, how do I get my registration key?
There is a link when you go to Green Shield and you have to log in. There's a section that says, if you don't have a registration key, click there. And if you click there, it'll ask you a bunch of questions and they'll be able to help you out.
Thank you. So I hope that, yeah, so Rena says thanks.
Awesome.
So those are all the questions that I've received in the chat. If anyone else has any questions, feel free to sort of speak up now or type in the chat. And once again, we thank you for all those great questions and for attending this evening. Right. So the next question is, if I have opted out of dental and health due to other coverage, am I able to still access benefits with my GA for physio, which my current benefits do not cover?
Yes, did you opt out of the entire health plan or just the dental and vision portion of it?
Both of them.
Gotcha. Okay, so if you've opted out of the UTGSU health plan, then you wouldn't have the top up because the top up is in addition to the UTGSU health plan, which means you've probably opted for plan B, which is just the healthcare spending account, which you can put in physio in there if you'd like.
Okay, and then so how do I access this plan?
Use the UOT plus your personnel number.
Okay, perfect. Thank you so much.
And yes, for everyone, Alyssa had put that in the chat. So it's UOT plus the personnel number for your QP benefits, to access your QP benefits on the Green Shield website. Okay, and we have one more question. Will the HCSA insurance expire the moment my GA contract ends?
No, your health insurance goes from September to August. So if your GA contract is only until April, you'll have health insurance through the summer.
So Lydia says, thanks. All right, and feedback. There's some feedback. Thank you for such a clear walkthrough. I've registered on Green Shield for my top-up account just now. So great.
Amazing.
Amazing. So I hope you all download the app too, because that's been very convenient, especially during these times.
I definitely, a suggestion, if I may, is I have the app and I have the the HCSA logged in on my phone, and then I have the UTGSU plan logged in on my computer, so I don't have to remember so many passwords. Just
That's really a great tip. So what is the app called?
it's the Green Shield app.
So Lewis, yeah, it's the Green Shield app. Okay, so I think there's one last, I don't know if it's a question or a comment, but I'll read it. If one remains 3907 member for 1 year after holding GA, do they also remain eligible for the top-up insurance?
That's a really good question. Let me just double check our contract, because I believe you do, because you are a member of QP 3907 for a year after your GA position. So like if you have a GA now, you would technically still be a member of QP 3907 up until April 2022. But as for the health insurance, that I am not 100% on. But what I can do, again, if you shoot me an email or shoot me your name, I can contact Labor Relations and find out specifically for you what your health insurance status is.
So yes, Lynn, you can shoot us an email and we will find that for you. All right, seeing those are all the questions. We thank everyone, and thank you, Alissa, for doing facilitating the workshop, and we thank everyone for joining tonight. Some of these questions will again be able to access on the website, and if you have any additional questions, shoot QP 3907 an email, and we'll be happy to answer any of your questions. So wish you all a great evening. Thank you.
Thanks, everybody. Have a great night.
Thank you.